begin discussing this very important topic.
Hey, thank you so much, Will, and thank you for facilitating today's WebEx discussion. I want to especially thank our speakers who are joining us today to discuss how do we improve the mental health and well-being of healthcare workers. First, Dr. Christine Sinsky, Vice President of Professional Satisfaction at the American Medical Association. Dr. Leslie Zunn, Medical Director at the Lake County Health Department and Community Health Center, as well as a representative of the American College of Emergency Physicians. Mike Hastings, President of the Emergency Nurses Association. Dr. Rekha Kasi, psychiatrist at Rush University Medical Center. And Dr. Edward Pollock, Medical Director and Patient Safety Officer at the Joint Commission. Thank you all for taking precious time out of your schedules to join us today. And thank you to all of you who are at home viewing today's WebEx discussion. I want to say a special thank you to Rebecca Lauer of my staff for organizing and putting hard work into today's discussion. I'm excited to have all of you together, and I also want to welcome all of those who are joining who are equally touched by the issues that we're going to discuss today. Just as a reminder, if anyone has a question, please submit it via the messaging feature at the bottom right of your screen, and we will devote time at the end of this call for a question and answer session. As the husband of a physician, I know firsthand the burden borne by frontline healthcare workers. They risk their own health fighting this pandemic while confronting its devastating human cost on a daily basis. It's incredibly concerning to go into work every day with the knowledge that you may have been exposed to a potentially deadly virus. After all, as of yesterday, an estimated 72,000 American healthcare workers have been infected with COVID-19 and nearly 400 have died, which is why it is understandable that we have heard countless tragic stories about the toll this pandemic is taking on the mental well-being of these healthcare workers. Some experts estimate that 20 to 25% of all healthcare workers in COVID-19 hotspots could end up developing anxiety, depression, or PTSD. That's comparable to the rate of PTSD among soldiers returning from combat. One study found that in hospitals with COVID-19 patients, healthcare workers had alarming rates of symptoms, as 50% suffered from depression, 45% from anxiety, 34% from insomnia, and 72% from distress. And many of these professionals were struggling before the COVID-19 pandemic hit. It is estimated that before this pandemic, we were losing almost 300 to 400 physicians alone to suicide each year. It is time we did our part to help these workers through this crisis and beyond. But unfortunately, to date, government has not done nearly enough. Recently, I led a bipartisan letter with almost 100 of my colleagues calling for enhanced resources to support healthcare workers' mental health in any future coronavirus aid package. Today, I'm announcing that I will be introducing new legislation to give our healthcare workers the wellness resources they need during and after this pandemic. This bill will authorize the Secretary of Health and Human Services to provide grants for healthcare workers, to provide or expand programs designed to promote mental wellness among their workers on the front lines. In addition, it will authorize the Secretary of Health and Human Services to commission a comprehensive, multi-year, longitudinal study on the broader issue of healthcare worker mental health and burnout, because this is not an entirely new challenge, nor one that will quickly disappear after the pandemic. My Republican colleague in this effort will be Representative John Katko of New York, who will be helping to lead this bipartisan effort. I'm also teaming up with Senators Tim Kaine and Jack Reed on additional legislation tackling these important challenges. So those are some of the legislative steps I have been and will be taking to help ensure our healthcare workers' mental health. And now I'd like to bring our panelists or speakers into the discussion. We're going to start with a few questions that I'm going to direct to our panelists. I'd like to allow them time to answer, and then we'll open it up for a broader discussion, including from folks who are participating in the audience at home. First, Mr. Hastings, would you please share some of the new mental health and wellness challenges this pandemic has created for people in your profession?
Yeah, thanks, Congressman, for having us on here and to talk about this. Just kind of as you alluded, right? So as your wife is facing, seeing these patients and potentially being exposed herself and then coming home, right? So it's knowing, what potentially deadly virus are we taking home to our own loved ones? A lot of us are parents or have elderly people that are living with us, so at-risk people. And so we have to think about, what are we doing, right? Like we get in this profession to help people, not necessarily to harm people. And yet here, potentially we're harming our own loved ones when we go home at the end of our shifts. I have my mom that lives with me that's in the elderly classification, and I have two young boys. I'm in a busy emergency department outside of Seattle, Washington. So we were in the very front line of this when it hit the United States. So that stress that we see, from our day-to-day operations of what we're taking home to us is definitely one of those things. The other thing is just around, the whole conversation around PPE and having adequate supplies, and how are we doing, from maintaining our own safety. When we change regulations of what PPE that we're using, obviously that adds more stress onto the frontline healthcare workers. And so it's really understanding, where are we at, what resources do we have, and how can we maintain our own safety? And that's what creates that anxiety for our frontline staff. And again, and it's that, as you alluded to, the PTSD, as okay, I'm getting ready to come back into my shift. What am I going to be facing today? Because everything's changing and everything's different. So kudos to you for taking the lead on helping to get us some resources to be able to make sure that our frontline staff have the resources so they can maintain their mental health and well-being, because without them, we're not going to be here to help serve our communities.
Very good points, Mr. Hastings. Thank you so much for making them. And it looks like you might be at work right now as we talk. So thank you for taking time out of your shift to talk to us. Next, I'd like to direct a question to Dr. Kasi. Dr. Kasi, could you please speak about the lasting impact you see this crisis having on healthcare workers' mental health?
Thank you, Congressman, for bringing up this important topic and for all your work in it. That's a really good question. It's really too early to tell, but from what we know, like as you mentioned, we have some data from China and Italy showing that about half of people treating patients with COVID have anxiety and depression, and about a third have insomnia. There's most definitely a concern that healthcare workers can develop trauma and stressor related disorders like PTSD, particularly frontline workers and people who have been working near an epicenter. COVID, as mentioned before, is a time of loss and grief, and there are additional stressors for healthcare workers that the general public, may not have. Some of the factors that we're concerned about that may be more likely to lead to PTSD are people being afraid for their own personal safety and also fearing for the personal safety of their loved ones. This is, of course, compounded by the shortage of personal protective equipment. I know a doctor with COVID who lived in a different room of his house for 2 months. He talked to his wife on the phone, and he delayed seeing his grandchildren for several months because he was concerned about spreading the infection to them. So having this loss of your usual support system also plays a big role in this. So it is important. There are some hospitals that are taking steps, for example, doing debriefing sessions with staff and encouraging basic things like eating, sleeping, and exercise. we also need to make sure that while we support people now, that we keep mental health on the forefront of our minds, because there will be people who will continue to need mental health services in the long term.
Very good. Sorry, go ahead. Keep going.
Uh, um, Thank you. Yeah, and one really there is going to be healing, and one really great thing that has come out of this has been a huge boom in telemedicine, which might be a way for people to access care in the future.
Very good. Thank you so much, Dr. Kasi, and congratulations, you're a new mother as well. So that's another interesting development, and thank you for taking time out of your busy schedule to be with us. So I really appreciate that.
Thank you.
Absolutely. Dr. Zun, could you please tell us a bit about the barriers to health workers seeking treatment for mental health conditions and what you believe could be done to overcome them, especially in the post-COVID era?
Well, thank you so much, Congressman. I appreciate the opportunity to speak to the group today. So one of the major barriers that physicians and other providers have is seeking treatment. They're worried that if they seek treatment, they may not be able to get licensed. They may lose their income and have other career setbacks. Many of the state licensing boards and other credentialing agencies ask the question, have you ever had a mental health problem or sought mental health care? That is a barrier, especially because we know that many healthcare workers um, are having lots of stress, lots of concomitant psychiatric and social problems associated with that. And rather than deterring treatment, we encourage them to get treatment. So the American College of Emergency Physicians, together with the Coalition for Psychiatric Emergencies and 45 other professional organizations, came up with a statement. And it's titled "Supporting Provider Health in the Post-COVID Pandemic Era." And really, what this position statement says is that we want providers to get mental health care. We want to encourage it. We want to reduce or eliminate any barriers, perceived or real, that stop them from going to get the care that they need. And so we're pushing for legislation and a better understanding on a state level and a federal level of, we cannot put up these barriers. We need to open up and encourage folks, providers, to get the mental health services that they need, that we support not only professional services, but in some non-clinical services, some peer support organizations or opportunities for providers. And so lastly, we really think it's important that we support and expand access to treatment, and that gets properly funded, and that there should never be a concern about self-referral or fear of reprisal if one goes for treatment. So thank you for the opportunity to present that position statement, and I'm happy to answer questions.
Well, thank you that's an excellent point with regard to those state medical licensing criteria. Perhaps going forward, they should revisit whether that question should be on there, because it could deter people from seeking help. Dr. Sinsky of the AMA, could you please speak about how important it is to ensure healthcare workers find joy in their work? Indeed, I think your title is about professional satisfaction. So, how important is it for healthcare workers to seek and attain that kind of satisfaction in their work?
Well, good morning, everyone, and thank you, Congressman. And indeed, my title is Vice President of Professional Satisfaction, but my husband calls me the Veep of Joy. And the unit I lead, we see as our mission to help to create the conditions where joy, purpose, and meaning in work are possible for physicians and other healthcare workers. So that's what drives us every day. And you are so right. This is an issue that's been present for some time, exacerbated now by our current public health emergency. We've been studying physician burnout for the last decade in partnership with Mayo and Stanford, and we've been surveying physicians periodically every 3 years. And what we've found is that roughly half of US physicians are exhibiting some sign of burnout at any given time. And if something is affecting nearly half of the US physician population, we know that the problem has to be rooted in the external environment rather than simply reflecting weakness on the part of a few susceptible individuals. And this matters. Burnout really matters because when we're burned out, we make more mistakes. So medical errors are twice as likely among physicians who are burned out as opposed to those who are not. In addition, it's costly. We did a study last year that found conservatively that burnout among physicians cost the US health system nearly $5 billion a year. And it matters to physicians and their families. Physicians and their families who are affected by burnout, physicians have higher rates of disease, of drug and alcohol use, of divorce, and very tragically of death by suicide. And that is something that drives us to help to prevent that. And I'll just add a note, you are so right about the state by state variation and how questions are asked by the licensing board about either current impairment or past impairment. And one thing we recommend is that states change to asking only about current impairment rather than past impairment to reduce one of the barriers to seeking help. Thank you.
Thank you. That's really helpful. And I think also connecting the importance of joy and satisfaction for healthcare workers to the outcomes for their patients is equally important so that people understand the consequences of not treating this important ailment, mental impairment or lack of well-being or lack of satisfaction. Let me now direct my next question to Dr. Pollack. Would you mind please sharing some of the best practices the Joint Commission has identified for promoting the psychosocial well-being of healthcare staff and also explaining how they were developed?
Sure. First off, thank you, Congressman Krishnamurthy, and to the other panelists. I first want to say that personally and professionally, this is a topic I approach with great humility because professionally, we're hearing from providers all over the country, clinicians, saying how devastating this has been. Because in the setting of taking care of a disease with no treatment, no vaccine that's effective, they're seeing unprecedented volumes of acutely ill patients, but also they don't have either they don't have the support in some cases that they need simply to take care of themselves on so many levels. And at the Joint Commission, we've been active in supporting clinicians on just these topics. To Dr. Zun's point, we joined them, the American College of Emergency Physicians, in that statement. We absolutely agree that a history of mental illness should not in any way be required to be asked, and we don't ask that at the Joint Commission. So I just wanted to clarify that. Personally, I provided care on the front lines in the epicenter in New York as an anesthesiologist and a critical care attending. And what I saw was exactly what you talked about was, one night I was on call and somebody came in, somebody in their 20s, and they just broke down crying and they said, people said, "What's wrong?" And she said, "What are you doing here?" And she said, "I live alone and everybody here is so sick. Nobody is happy. Patients don't get better." And so we felt so personally, I experienced that and then had to self-quarantine after I finished that for 2 weeks, being away from my family, and experienced exactly the isolation that people are talking about. So I think it's so important. The best practices that we highlighted recently in a quick safety publication, that's one of our publications, as well as a webinar that we partnered with the National Council for Behavioral Health. We really highlighted exactly what Dr. Kasi talked about, which is there are some things you can do as an individual to take care of yourself, which is very intentionally to build in certain features to make sure that you schedule connections, right? It's very easy for people in this environment where we are encouraged and in some cases required to physically distance to then socially isolate. And that can be devastating because then you lose the supportive features. So you actually have to intentionally schedule that in. And leadership at organizations has to do that, checking in, being sure that they provide peer support. So that is leadership then cascading down to management, cascading down to the front lines and building that in. So a best practice, for example, that we've seen is baking in before, say, daily safety huddles, which many organizations have, which are clinical, baking in a moment of self-reflection where people think about how they're going to take care of themselves. The other thing is buddy systems can be helpful. And lastly, exactly what Dr. Kazi does, which is in some cases providing professional help. But we know that there's not enough professional help out there. There aren't enough mental health resources to take care of the vast number of people who are affected by this. So I really want to thank all the other panelists, but especially you, Congressman Krishnamurthy, for bringing this forward. It's such an important topic.
Well, thank you so much, Dr. Pollack, and you raised some really great points in your presentation. I have a bunch of questions, but before I hog all the questions, I want to ask Will, are there any questions from the audience yet?
We do. We have two already.
Okay.
One from and again, pardon me if I mispronounce your name, Gina Mulanthara, who asks, as an occupational therapist, I would like to hear a little bit about the unique situation of nursing homes for both patients and clinicians in the time of COVID as well as beyond.
Great. Who would like to tackle that question? Not all at once. Dr. Kasi, would you like to take a stab at that?
Absolutely. I mean, one thing that's kind of unique about nursing homes is, there can definitely be an outbreak and quick spread. From what I have heard about of people in nursing homes, some of their families are visiting them outside. I had a friend whose dad was in a nursing home, and she got there right before the visitor restrictions went in place. So she had to see her dad from the hallway, and the staff said, no, you can't see him. You can only see him through the window. So that kind of thing is really difficult.
Yeah. Anybody else? Would you like to also talk about what it would be like to be a healthcare worker within the facility?
Sure, I'm happy to respond to that. We know from a survey of physicians that over 60% of physicians are fearful of exposing themselves and others to COVID. Imagine what it's like for nursing assistants and housekeepers and others within nursing homes. So we have created at the AMA a survey called Coping with COVID that we've made available to institutions at no cost, and it's for all role types. And so we've been able to analyze the first 2,300 physicians. We've got 10,000 respondents altogether. Many of the organizations that have signed on are nursing homes. So I think we will soon have data around how the workers who are working at nursing homes are dealing with this stress and what the levels of stress and anxiety are. And I think that's really an important sector of our workforce to be paying attention to. So I appreciate the question.
Sure. Dr. Pollack?
Yeah, thank you. So at the Joint Commission, we accredit organizations across the continuum of care. And one of the things in preparing some of the work with the National Council for Behavioral Health that we realized is that, and it's great what Dr. Sinsky just said, which is in many cases, doctors and nurses have, though limited access, they do have access and some training to, in say, hospital settings, to various peer support programs, second victim programs, employee assistance programs. And there's a kind of cross-checking that in best cases happens. In so many of the people who are affected, we know, are, as you said, in nursing care facilities. And one of the biggest problems is that, there's not a similar setup of support in a typical nursing care facility with that infrastructure. There's not typically employee assistance, peer support programs. You also don't have colleagues who have professional expertise in it. If you're in a hospital, you have professional, you have some professional training in many areas, but you also work with psychiatrists and psychologists and psychiatric social workers. In long-term care facilities, that may be true, that may not be true. It's a much less. There's much less of penetrance of that sort of support. And as was commented, in some cases, the people, say, nursing care assistant who may have experienced, one death a month previously, may see, dozens in several weeks. And the environmental services workers who are having to clean rooms, they're putting themselves at great risk in those settings as well. And there's there's a little bit less of a narrative around the heroes that those people are as well than there is with, say, doctors and nurses.
Sure. Will, what's the next question?
We have one final one from offline, as we're conscious of everyone's time. But the question is, what's the value in there being another study on these mental health challenges faced by healthcare workers? I think it's referring to both the Congressman's study and also some of the points that have been made by our panelists.
Okay. Well, why don't we start with Mike Hastings? Do you want to take a crack at that? Like, why bother studying this issue, and why does it matter?
Well, I think right now, why it matters is because this is unprecedented times that we're facing with COVID-19, right? So, we know in a disaster, after a disaster, we have a time of impact, and then we can kind of map out from the time of impact of a true disaster of when people will have psychological impacts, right? What we don't know for COVID is that there's not a time of impact because it's a roving disaster, essentially, right? And so the things that and the way that people are responding are different now than what we've ever faced before. And so it's important for us to understand what the current situation is and figure out best ways that we can minimize that impact to our healthcare facilities and our workforce. So I think that's why it's important for us right now to capture this data, is because we've never been in this situation before where we're able to capture this kind of data and figure out what interventions are truly going to work.
Got it. Dr. Leslie Sun, do you want to take a crack at this as well?
Yeah, I think it's really important that we understand what's going on with the healthcare providers. And in order to best meet their needs, we need to better understand what concerns they have, what interventions would be effective, what barriers are they dealing with, and how to best deal with treatment. So the more information we have, the more data we have, the better able we are to focus resources and meet the needs of the healthcare providers. This is unprecedented. We don't know. We're having, it's usually we're used to the disasters that are really quick in time and scope. This is very broad over a long period of time that we really haven't experienced since 1918, I think it was. So we need to better understand how to best support the healthcare workers.
I have a couple questions. Will, is there somebody else that has a question from the outside before I type in?
Yes, we have one more question here. And this is especially with regard to Illinois. Governor Pritzker's executive order granting healthcare providers civil liability during the early phase of the pandemic did a lot to decrease legal fears and improve mental health among my colleagues in and then, unfortunately, the question cut off. But I think there's a question as to whether there's work towards protections for doctors, especially in Cook County and elsewhere, in terms of the legal questions that emerge as doctors are working under these special stresses?
Okay. That's a very interesting question. Dr. Kasi, would you like to pipe in on this issue? How much does concern with that kind of exposure kind of factor in to people's mental anxiety in this novel situation with coronavirus? And are there things about this coronavirus situation that are like unlike anything that physicians have ever seen and kind of contributing to their anxiety?
Yeah, of course, all these factors of the unknown, not knowing, what's going to happen, and also, just the idea that doing your job and also putting yourself at risk that way could lead to, legal cases down the line is very scary. So I think this really helps healthcare workers feel supported. There are definitely things about this that are unlike anything we've seen before, just has been said, the volume, the rate of deaths. Um, so, so those are all things that are really important here. And one thing that's interesting as well is that, PTSD itself, one of the core features is to avoid talking about the trauma. So we may really need to seek out people for help because that's part of the illness itself.
Interesting. Yeah, I think as I was just thinking about this question, it's I'm gonna put my question in anyway because I haven't had a chance to ask it. But like, um, if anyone wants to take a crack at this as well, which is um, the level of deaths. Obviously, we've surpassed 100,000 deaths. We're now at maybe 112, 113,000 deaths as a country related to this. Um, I guess just the fact of the the volume of deaths and talking to the families of the ones who are deceased, um, maybe being in a situation where so many people are on ventilators and you really don't know who's going to live and who's going to die. How does that affect people's mental health? If you're a nurse or a doctor and you're in that situation, and usually you have a path toward recovery in a lot of cases, but here you just don't know what's going to happen, and you have to talk to that family and kind of counsel them through this. How does that affect things? Dr. Sinsky or Dr. Pollock, would you like to weigh in?
Sure, I'll start and then Dr. Pollack can finish up. But clearly, it's really stressful for nurses and physicians to be not only the professionals, but the personal caregivers for patients at the time of their death. When family members can't be present, they're the only human presence that is there. So that's an unprecedented role and stress for our healthcare workers. And then just the frequency of the uh, severe illness and death with which some of our healthcare workers are facing, instead of experiencing an occasional patient who doesn't survive, they're experiencing patient after patient after patient. So
Yeah.
I think you're right on that is one of the sources of stress, and that sense of helplessness that we don't have the tools to offer that we want to offer that will lead to healing.
Yeah, I've read stories now where it's the physicians who are basically, using their iPhone to communicate a last text or a last phone call from a loved one, or just a video call or something, and because the loved one can't be there themselves, and I think that has got to be um, that's got to take such a toll on the physician, but or the nurse. Dr. Pollock, do you want to weigh in as well?
Yeah, I can comment both professionally and personally. I would agree. It's something. I, as an anesthesiologist from a level 1 trauma center, was I would say thought I was prepared. I'm used to dealing with very sick people, And I'm used to dealing with some bad situations, and even people dying over the course of a year, here and there. But you're 100% right, Dr. Sinsky. The absence of families there made it totally different. So as attendings in critical care, we would call the families at night to update them, often FaceTime them, and families to limit the spread of an already devastating illness. The families, of course, were not allowed to visit these incredibly sick patients in ICU. And they would, in addition to really trying situations where they would beg you to save their loved one, when it was clear that that wasn't going to happen, and their, father, mother, sister, brother, sometimes son was going to die, they would ask if you could, if they could have a meaningful prayer played in their room, if you could hold their hand so they wouldn't die alone. And just the impact of that on the providers, the caregivers right there, becoming suddenly the support for the patient so that they could have a dignified death. That's something. I was in a facility that has tremendous palliative care, tremendous resources. But again, to limit the impact, it was the frontline caregivers that were doing that, because the more people interacting with these patients, the worse. So I think that's just something that's very underrated in this, is that while we all know the importance of patient and family-centered care and the family's role for the patients to do better, but what I never realized before is that not having the family there just really changes it for the caregivers, the providers, the medical staff.
It almost feels like the nurse or doctor becomes a surrogate family member, especially toward the end, because nobody else is there, and they probably, in playing that role, are also going through a lot of the emotions that the family does, because they're getting more and more kind of involved in that person's affairs. So I could go on kind of asking you folks questions about this all day or all morning at least, but I think our time has come to a close. I just want to say thank you to all of you for doing what you're doing on an everyday basis in your day jobs, so to speak. Taking care of our patients, tending to them even in their most dire hours, and remaining on the front lines. And now I think it's up to us to help provide some support to our doctors and nurses and other healthcare workers, so that we can ensure their mental health and well-being, and also ultimately also better outcomes for the people that they're caring for. And so please stay tuned to the legislative developments with regard to this bill. We will continue to push, and Rebecca and Will from my office can be your points of contact on this as well. So thank you all again. I really enjoyed our discussion. I think you put a human face on a very severe problem that we're experiencing in the healthcare world. And I hope that we can together do something positive to deal with it going forward. So thank you again, everybody.
I want to commend you for your focus and your interest in looking at healthcare workers in our situation. So thank you so much, Congressman. It's very much appreciated, your interest and focus.
Yes, sir.
Actually, I'd love to underscore the importance of the bill that you're introducing and the grants, so that we can learn what works for reducing acute stress into chronic stress reactions, and that we have more knowledge that comes out of this. So thank you so much for that, Bill. I think it's really critical.
Thank you so much, Doctor. And thank you to all of you. And I look forward to maybe continuing this dialogue again in the near future. So thank you.
Thank you, Congressman.
Okay, thank you.
Thank you.
Thank you. Thank you.